Caregivers, have you ever felt like nothing is going right? Well, cheer up and welcome to Dave, the Caregiver's Caregiver radio program, where you'll learn how to avoid that dreaded thing called caregiver burnout and how to survive the grieving process. Join Dave and his guests now as they share practice tips and tools that you can start using immediately to help get you through this day. Now, here's your caregiver host, Dave Nasani.
From Waikiki, Hawaii, a big welcome to all my listeners out there in Radio Land. I should say a big aloha welcome. I'm Dave, the Caregiver's Caregiver, coming to you live and on demand 24/7 and on 14 global platforms like iTunes and YouTube and Spreaker and Podcast.com, SoundCloud, Vimeo, I mean, the list goes on. And also at CaregiverDavid.com, voted number 2 of the top 6 best caregiver podcasts of 2017. We have an exciting show planned for you today. Unfortunately, my lovely co-host Adrian can't make it again to this week. We're just 2 ships passing in the night for the last couple of weeks because I'm in Hawaii, and it's hard with 6-hour difference between the two of us to coordinate our schedules. I will be interviewing Helen Justice, President and CEO of Advanced Wellness GCM, Inc. For 9 years, retired U.S. Air Force, 21 and a half years, and alternative healthcare, 18 years. Speaker and author of a guide for the children of aging parents. So let's get started. Before we do, I want to thank my last week's guest, Christina Ashley. We spoke about death and dying. It was a great interview, and you can listen to that interview and all our interviews right here on CaregiverDave.com and all the networks that I mentioned earlier. All right, enough of that. Hey, a big LA, I keep saying LA, a big Hawaii aloha welcome to my guest, Helen Justice, known by many as the Elder Care Navigator. Helen is a Certified Geriatric Care Manager trained to assist elders and their families with the process of aging with dignity and grace. Welcome to the show, Helen. So excited to have you finally on the show.
Okay, thank you for having me. So, I like to be where you were at.
Well, one day you will be,
yeah.
But I'm half of me's on vacation. The other half is speaking like every third day somewhere. I think that this Friday I'm speaking at the University of Hawaii. I'm going to be talking about a deadly occupation, caregiving. So I'm excited about that, and there's other speaking events as well. I'm trying to just relax in between. So I like to ask my guests, this is a deep question. Are you ready?
Yeah, ready.
Why don't you take a minute or two and introduce yourself? I like to ask my guests, just who is Helen Justice and why was she put on this earth?
Well, I was put on this earth to serve people. I know that, and that's where I have been all my life, is serving people, no matter if it's in the military, outside the military, but it's kind of progressed. So in the military, I ended up being a squadron commander. My last squadron was 800 people. C-5 aircraft, men and women. Then I moved into alternative healthcare for 18 years. So that was a lot of schooling and helping a lot of folks. But I noticed that my clients they were aging. And I was passing my clients off to people that did not have good reputations when I found out. So I went back to school to become a geriatric care manager and opened up my own office. I didn't want to start a new business after alternative healthcare, but here I am. And so Advanced Wellness Geriatric Care Management has been open since July of 2009, and I have been speaking all over the place. Matter of fact, this year in January, I put a goal out there for myself for 120 speaking events for the year, and I booked my last 120th last week, so I made the goal. So
wow, you're speaking more than I am. Good for you.
Yes. So
and you were in the military, huh?
Yes.
What rank?
I was in the Air Force, and I went in and enlisted, and got my college degree in night school, and then went on to become an officer from that point on. So 21 and a half years in the Air Force. So,
a real overachiever. Good for you.
Yes. So
who are your primary customers and clients, really?
My primary is primarily anybody 60 and above. And then the secondary is daughters of aging parents. And these daughters are about 55 years old. They're still working. Maybe they've got college kids or maybe even high school kids. And now they're finding that they're needing to be caregivers for mom or dad while trying to take care of their own family. And so that's really my target market, and is the boomers who are now starting to take care of mom and dad. But, as far as the folks that I help is anybody 60 and above. And we're putting together their last chapter, if I can use that terminology. The last, what if it's, 10 years, 20 years, 30 years. But we're putting together that last chapter that nobody has ever sat down and said, okay, they got the legal, they got the finance, but they haven't got the healthcare plan. And what if? What's plan B? Nobody's got a plan B.
So there's no long-term care.
Right.
So if I'm 64, I'm officially classified as a geriatric, huh?
Not a geriatric, I wouldn't put it that way. But it's getting up there to understand your benefits and what you have to do to prepare to get those in the future.
I like to call it my golden chapter instead of my final chapter.
I know, but a lot of people and my seniors, they don't know what's golden about it. Pills, pain, loneliness. Yes, that's not.
Wow.
They don't call that golden.
Well, I'm sure glad there are people like you in the world taking care of the elderly, and I'm just proud of what you're doing. Congratulations, and thank you for what you're doing. How do they find you?
Well, several ways. My primary resource of clients is referrals. I've been in doing this almost 13 years, and so the clients that have come through me in the past is referring. Second method is speaking. I'm out there educating them on all their public benefits, how to get lined up for it. So speaking is my next way. And then, of course, networking with professionals and letting them know there is an alternative than, trying to throw a dart at a wall and hopefully you hit it. But I developed a kind of a one-stop shop. So tell me if, I'm not an a la carte company. I'm a buffet line. Tell me your issue. Tell me your problem. I'm going to solve it. And if I can't solve it, I'm going to get a resource to solve it. So that's how I kind of develop advanced wellness, is to make sure that we can take care of all issues, no matter what it is. And even if it's mediation between the adult children and mom and dad. So we're able to solve those issues, give a care plan, give them steps to go through, because many people have no idea what they're getting into.
So you're an entrepreneur, you're a speaker, you're all these things. Were you always like writing when you were in the service? Were you always like entrepreneurial? When did this just happen? You woke up one day and you says, I'm an entrepreneur, I'm going to do this. I'm an author, I'm going to do this. How did it happen?
Well, I got my master's degree, and I thought I was going for corporate America when I got out of the military. And that year, the word was downsizing, right-sizing. We don't need your help. So I had taken some alternative healthcare classes and thought it was something fun to do besides academic. And it developed in a whole business in itself. But no, I'm not the writer or anything, and finally had to go back to school to be able to do the public speaking. To believe it or not, squadron commander out of the military, I was terrified. So I went to Gale Carnegie School and was able to conquer that demon of public speaking. So I'm comfortable in front of large groups. But what terrifies me is video, and here we are.
Wow, so you actually reinvented yourself. Is it fair to say? You came to the conclusion, okay, now what?
Yeah.
I'm this old and I have these skills, but this is drying up, and so I need these skills, and I need to be here, and here's how I get there. You're a smart lady too, and a very brave lady. I commend you. Wow.
Thank you.
So yes, if you're weak in the area of video, congratulations for your very first video. And I guarantee you it won't be your last because you're actually very
No, I
good.
got video out there, but I don't look at it. It's for the public. Let them look at it. Yeah. So,
Well, we'll make sure that both of us promote this video for you. And so let's talk about some of the costly mistakes that many make on public benefits, right? Social Security, Medicare, Medicaid. What are some kind of mistakes that people are making on the so-called public benefits?
well, the number one is people are not getting legal documents done in a timely manner. And so the trust and power of attorney, advanced health directives, at least people should be getting those three items: power of attorney, advanced health directive, and a HIPAA document. Those are so powerful in the adult children trying to take care of mom and dad. But they're waiting too late. They're waiting till mom or dad has lost mental capacity. And when they wait to that length of time, there is nothing we can do. And they're done with trying to get public benefits because they don't have the legal documents in order for us to move forward. So that's the number one. If you got a trust, and many people do have a trust, but once they get the trust done, they put it up on the bookshelf and there it sits. And this should be brought down every 3 to 5 years and go back to your elder law attorney and have it reviewed, because life happens. Maybe you've lost a child, maybe you've lost a loved one, and it needs to be redone. And so they're just waiting too long to get the legal documents done. I just can't express enough how important that is, because I don't know if you remember a gal down in Florida, Terry Scheibel, and she was on life support for 15 years because she didn't have the basic power of attorney, advanced health directives, and a HIPAA. And her husband went through hell trying to get this that she wanted, but the family did not. So if they don't do a will or a trust or anything like this, at least get those three documents done. I mean,
Right.
Celebrities. We just lost a celebrity that didn't have a will nor a trust. And it's going to be in litigations for years and years, and the probate attorneys will get a big check on that.
They are the winners, aren't they?
They are the winners. So the next thing is, they think the adult children, because they're smart and they've been to college and everything, that everything on the internet is true. And,
we know better, though, don't we?
Yeah, we know better. But they go out there and thinking that they have the answers. And there's some companies out there that are internet service, and they just do not do the job that is necessary to help an individual, guide them through each of the doors that they need to go through, and not open doors that they don't need to go through. And sometimes they just lead them down the wrong path. So the internet is really, yes, you can get some information out there, but here's what happens is we all go out there, even, to shop or whatever, and they always want your name, email address, and phone number. And I can tell you, if you're looking for senior care or senior placement, if you put those three items in 30 seconds, you're going to have a phone call, and they will hound you to death until you decide enough's enough. So I teach in my family training, which I do twice a month, is get you a dummy email address, Yahoo, Hotmail, any one of those, and give them a dummy email and get a dummy name and a dummy phone number, and give that, because you're just trying to get to the next window. You don't care about all that information. You just want the information. So in order to do that, give them a dummy email and everything. So
Oh,
Go
you're on
ahead.
the ball. You know exactly what's going on here. I'm just saying, yeah, yeah, yeah. That's good. I had a mother who had dementia, and she had passed away 3 years ago. Before that, we were looking for a place for her. We were calling around, all the franchises, the so-called franchises. It's true. You give them your name, your email, and you get floods and floods of people soliciting you. Maybe not even in the same neighborhood that you're looking. It's just like
Right.
you throw a piece of meat out to the sharks, and whoo, So yeah, that's a great, great, great idea. Now, before we continue, I want to take a short break. So don't go away. I know you've got so much more to tell us. So we'll be right back.
David Nassani.
Best-selling author Dave Nassani.
Dave Nassani.
Dave Nassani is a best-selling author. Where is the caregiver for the caregiver? That is where Dave Nassani comes in.
Mr. Dave Nassani.
Thank you. So you're needed.
I am needed.
You are very
Yes.
much needed.
I am
And
needed.
kind of one of a kind,
Yes.
right?
The woman I loved had suffered a massive stroke, left her severely speech impaired and paralyzed on the right side.
Well, the first mistake the caregivers make is they don't know how to put their needs first.
Now, the airlines tell us every time we go on an airplane that an oxygen mask will fall. Put your mask on first before you help your loved one with their mask.
Right.
For the next 2 years, our lives had become a living hell. And then there came a point where I finally had to just scream. I says, I can't take this anymore.
The second mistake that caregivers often make is they don't know how to ask for help. Now, everyone has one of these. It's called a cell phone. You turn it on,
Yeah.
you punch in the number, and you talk. Hello, Mom. I need help. Grandma's driving me crazy.
I realized there's so many other caregivers out there who are suffering, who are going through tremendous pain and feeling lost and alone. And I wanted to help them triumph over that pain. I didn't want them to give up like I almost gave up.
It's called Sanford and Son, right? He used undeserved guilt. It went something like this. Oh, it's a big one. No, son, really, it's a big one. Elizabeth, I'm coming to meet you, honey.
She's amazing to watch. She makes us normal people look like whiners and complainers. I mean, she's my hero. First of all, when someone is just wired like a caregiver, they're caring and they're giving and they give and give and give, but unfortunately they give until they burn themselves out. There's nothing left to give.
Yeah.
So now I host a popular iTunes podcast, the Caregiver's Caregiver Radio Show, and I'm a best-selling author to my third book. It's My Life 2, Reclaim Your Caregiver Sanity. I've been on my national book and media tour all across the country, just being on morning shows just like this one.
Yeah.
And I even shared the stage with Suzanne Summers at Harvard. Basically, I'm sharing my message, how to prevent your loved one's illness or disease from actually killing you.
Come and join our community of caregivers. Let us love on you. Let us support you.
Dave is an amazing man. I was in tears when I heard his story. He spoke from his heart.
Dave is really my idol because he created something for caretakers. And I was a caretaker for my father. Jeez, it's already 15 years and I'm still crying.
Every caregiver's life is a love story. Let me help you make that love story one of hope and triumph. Thank you very much.
And we are back with our guest, Helen Justice. Love your name, because you're going to get justice if you call Helen.
Well, that's my new slogan is justice is served.
Oh, I love that even better. So, Helen, what makes your company different from those thousands of people that are now soliciting all of your businesses from all the junk mails because you made the mistake of putting out your email and now they're just hounding you? Why is your company different?
Well, geriatric care management first. And so if you understand how vital that person is to you, we come in and we're able to do assessments, education, and put a care plan together. Is it plan A to stay home? Plan B, maybe go to, assisted living, boarding care. Plan C is, maybe skilled nursing. So we put those plans together, and how does the family fit into it? Who's going to be the caregiver if they stay home? And normally that's the wife. And as many of you know, the wife will probably pass before the husband being a caregiver, because it's a 24/7, 40 hours a day work. And you don't get compensated for it, and you don't take care of yourselves. And so we end up with the wife, the caregiver, in the hospital, and the person she's caring for. Now we got the children's got to step in, or we got an emergency situation that we got to find a place. So when you have a person that looks at the whole umbrella, not just the care of the individual, how are they going to financially be able to afford caregiving or assisted living? What are the public benefits that are out there that you can tap into? What are some of the grants? There's grants out there too. Sure. For Alzheimer's and dementia, there's support groups out there. It's got some grants. So how do you tap into all the different areas out there? And like I said, it's a one-stop shop that, I've got 5 attorneys that I have vetted, or I've got real estate people or financial people. I don't so much have financial people because most of my folks already have financial people. Mm-hmm. So I educate them, when somebody's coming in taking large sums of money out of their investments, there's other methods of getting this done without draining everything. And we want to make sure that whoever's left at home has something, that they're not, starving, or they're going to have to sell everything to survive. So we like to preserve, protect the assets, and still be eligible for public benefits. And we put on a family training twice a month. We want family at that training. We teach them about 3 public benefits: Medicare, Medi-Cal here in California, and VA. And this is for wartime veterans. So those are the 3 public benefits. And under each of those, there's additional benefits, such as under Medicare, most people don't know about palliative care. And that's my new weapon in my toolbox, as I call it. Yeah. So, when that puts me aside, there's no one out there educating, speaking, and telling folks how to get these services, when to do it, when not to do it, and of course, getting your documents put together, teaching the adult children. This is what you got to put together. Your notebook. Make sure you have these documents and get them in there. And if you don't have them, order them ahead of time so that when is needed, we're ready to go.
God bless you, Helen. You are absolutely right. There is no one that I know of, and I've been in this for many years, doing what you're doing, or doing it as concisely that has the knowledge of what you're doing. For example, the assisted living waiver program here in California on Medi-Cal. A lot of people don't realize that that's just a special pilot program, 5 years, and it went through its 5 years. It's on its second 5 years now, and they were actually paying $3,500 a month. Of course, they took my mother's Social Security check, which was $1,100 or so, and they paid the difference. But that's how much they paid the entire bill for the assisted living as long as she was in there. And thank God for that, because it's not easy to find a facility for your parent or your loved one. And like I always say, 9 out of 10 of them I wouldn't want to put my cat in, but you have to do your homework. You have to go there, do the smell test, show up when you're unannounced. Don't let them know when you're coming, because you want to see how it smells. You want to see how they're taking care of the people in wheelchairs. If they're just, scattered in the hallway staring at the wall, the lights are on and nobody's home, or if they have them actively involved in programs and stuff like that. You are amazing, and I commend you. You have so much knowledge. You have so much knowledge.
So there's a lot of internet companies that will not go with the family to tour. And that's what we negotiate the price ahead of time. We find out their needs, parents' needs, families' needs, location, and budget. And we put that all together. And then we come up with places for the family, and we actually go tour with the family and to make sure. And then we're not done. Once we get them moved in and everything, we're not done. Maybe the first 30 days, it doesn't go well. but we have to get back in there and tweak the caregiver or tweak the family. Yeah, and so, it's, I tell folks that I'm really in there until they take their last breath.
I wish I knew you 3 years ago, and I will be recommending you to a lot of my listeners, because what you have is what a lot of people need. They don't even know that you exist.
Exactly.
So why should someone do business or access service with you or your company above all the other options, including doing nothing or the same thing that they're currently doing?
I think they would get the education, because knowledge is power, as you know. And if you have the education and the right education, then you have choices. And a lot of people feel that they're trapped. They only have one choice. And maybe that choice is to sell mom's house right away. And that's the last thing that we wanted to do right now. We want to make sure that, the public benefits, which one's she going to apply for? If you sell her house now, this is going to eliminate her from 2 public benefits. So
Which two, by the way?
Medi-Cal and VA. Yep, Medi-Cal and VA. If you sell that house right away, without being in front of an elder law attorney or someone that's got the knowledge, you can eliminate your parent out of public benefits.
Most people think that the only way to qualify for Medicare is to sell the house or get the assets out of their name or put it in the children's name.
Under Medi-Cal.
Yes.
Medicare, everybody 65 and above is on Medicare. But Medi-Cal, you got to know when to sell a house. And the other thing is, a lot of people, they hear the radio show and they get advice off there and they put the assets in the children's name. Oh no, we can't do that, because
there's a look back period, right?
Well, there's a look back, but if the adult children get into trouble, divorce, tax, whatever, mom and dad's assets go with them. And so you definitely do not want to put the kids on your house. You want to leave it in the parents' house and learn how to protect that house, those assets. And you got to be in front of an elder law attorney.
Yeah. And what if they're already in a living trust?
It's still, because in order to apply for two of the benefits, those assets can't be in the mom and dad's name. So there's an asset protection trust there's 9 different trusts. And so we'd use an additional trust that the adult children are in charge of, but they're on notice. They just can't willy-nilly go in there and spend mom and dad's money.
Yeah.
Which that goes on a lot. But the assets are in there. And then the clock starts for the look back, so forth and so on.
Yeah. So everything's changing. The rules change and regulations change. And so how do you stay on top of things? And where do you see yourself being in like 5 years? Doing the same thing or evolving?
Well, in order to keep up my VA credential, I have to take CLEs, continue legal education. And I'm not an attorney. And but
probably know more than attorneys.
Yeah. And VA requires us to keep up our education, every year on that. And then Medi-Cal, it's always evolving. Each family that comes to me, I learn something new. They got different puzzle pieces that we put together. And there are lessons in there, not only for them, but it also for me. So that, I dig in there a little bit deeper, and go get this training. So that's how I keep up with it. I mean, if you think VA on one side, Medi-Cal on the other, you ought to be in my head. So,
how do you find the places to speak? I mean, do you book yourself? Do you have someone who books you?
No.
I'm just so curious. Where are some of the places that you're speaking?
So a lot of the places that I'm speaking, for instance, charity groups. I spoke at Lions Club, Rotary, those types of places. Assisted livings. Not this Friday, a couple Fridays, is the railroad retirement community. And there should be about 75 there. So your different groups out there that have got, an association or a club, VFWs, so, and I book myself. I tried to hire a person to book me. Oh, boy, that was a disaster.
So give me an example of how you book yourself. So let's say you're calling an assisted living place. You say, hi, I'm Helen Justice. How does the conversation usually go?
Well, I have a relationship with probably the assisted living marketing. And the way that we get in there, I have put together a panel. And rather than just me, and I did that for the first few years, but I have a panel now. And the panel is a Medicare person, all the changes going on there. The second person is a person that knows palliative care. And then myself as VA and Medi-Cal. What better avenue is to teach, your families and everything, those benefits right there. So we help the marketers understand that we will build your flyer. We will put it out on social media. I give them a suggested list of where to market, where to advertise, and then we book it that way. So no, I do the booking myself in different places.
Wow. So I temporarily lost your video, but I can still hear you, so I'm sure it will come back. There must be some internet issues. But what do you see? What is the biggest obstacle that you face in your job or your company on a daily basis that you found?
Procrastination.
Oh.
Yes, and on both sides, aging parents and adult children. They are just waiting too long to start the process, waiting too long to get education and know what's out there. And it just breaks my heart when the family comes and there's nothing I can do for them. It's too late. It's too late to get hospice in. They're waiting hours before the individual passes away. And, procrastination is my biggest obstacle.
So you got to tell people that's your message. I can see how easy it is for you to just pick up the phone and book yourself anywhere and everywhere. Anyone who will listen to you, you're amazing. You're such a go-getter, and that's the kind of person I want working for me. If I have a loved one who needs care and I have no idea what I'm doing, I'm overwhelmed, I'm getting phone calls, people ask me questions and I don't know the answers to, they call you. One-stop shopping, I like your term, it's the buffet line. Take what you need and leave what you don't need.
Yeah, exactly.
So what something unique or different that people might find interesting about you?
Unique and different. Commitment and persistent,
I can hear that.
I will work an issue, a problem till I can't work it anymore. And that I know I've done everything to resolve that problem. And if I can't resolve it, I can't bring anybody in, I just got to face the music and say, okay, we can't resolve it. But it's persistent and determination to be able to help the family.
So you consider yourself a geriatric care manager, right?
Yes.
So you just explained a lot of the things you do. How do you make your money? I mean, who pays your fee so that you can, eat and pay your rent?
Okay. Good question. And there's different parts of my business that I get paid on and others I don't. So let's get the one out of the way that I cannot charge for, and that's the veterans aid and attendance for the application process. I cannot charge. It's against the law. But there's volunteers out there that will charge from $3,500. I just had one recently, a person charged $25,000.
Are they doing it legally or are they doing it illegally?
Illegal.
Really?
There's in the regulation, it prevents anybody from charging to do the preparation, prosecution, and presentation of applications for VA. It is, it's against
the law. Who's the governing? Imagine that. There's people out there breaking the law and taking advantage of seniors.
Yeah,
so
really?
Who's the governing authority that one would call if they find somebody who's trying to charge them for something that should be free?
Well, here in California, they passed the laws that it is illegal. So the state governing attorney general here in the state of California. And then, of course, there's also the veterans. They have an office that you can turn them in. But I don't have time to,
Sure.
I'm not the police. I just want to get benefits in for folks. So,
now, can you help people who are not in California? Is your business nationwide, or you just kind of in the state, or how far do your boundaries go in helping people?
Well, I used to, do nationwide, and then I pulled back a little bit and just did Northern California here. And technology today, I are able to do like Zoom and do a consultation. And the consultations that I'm doing, care management, assessments, and all that, I do charge for that. So the second method of how I get paid is the placements. When a person, Plan A, does no longer work and they need to go into a assisted living or boarding care, then I get a percentage off the first month's rent. And it's a contract between me and that individual. And then, of course, I have care plans as a geriatric care manager. I got 2 different care plans that I have put together. And then, of course, Medi-Cal, I also can charge for. So all the ones that the only one that I cannot charge for is the veterans benefit.
Well, I'm learning so much. I thought I knew a lot, but you far exceed my knowledge and wisdom on the subject. So I recommend everybody call you up no matter what you're going through. Just I'm sure you'll give them a free consultation. Let them know, if you're the right person for them. Even if they don't live in California, you can be a resource for them, no?
I do. And what I do is there's 3 geriatric care managers in the United States that are VA accredited. Only 3 of us.
Wow.
Yes, because the test is so hard and the requirements are so hard. But
And you're smart enough to pass that test.
Yeah. So if I can't get you to one of the 3 of us, then at least get you a geriatric care manager. And I'm a member of the Aging Life Resource and the National Association. And I can find you someone, and I know that they've been background checked and their credentials have been checked.
Good.
They have to go through quite a process and pay an annual dues to this association. So I'm really confident, and the feedback I get is they really had a good experience with them.
Okay. Well, we're going to take another short break, so don't go away, and we'll be right back. We'll finish up with you. And you're listening to Dave the Caregiver.
Welcome, caregivers. Thank you so much for finding your way to our community of loving and supportive caregivers. We as caregivers understand and know the day-to-day feelings of guilt, fear, and loneliness. But guess what? There is hope. I, Dave the Caregiver's Caregiver, along with my team of experts and caring caregivers, have made this site just for you. We are a community of caregivers that understands and supports you wherever you are in your journey. We are a place to connect with other caregivers, but more importantly, a place to get practical, actionable help. There are lots of ways for you to get support. First of all, you can download our welcome pack. This will get you started on your Thrive journey. Next, you can ask and get answers to your questions by posting them here in our private Facebook groups. You can also get live online support by attending one of our live weekly Connect webinars. You can get practical, actionable advice by listening to our weekly podcast. You can hear and read other stories about other caregivers' experiences. Plus, add your own in our weekly Share Your Story forum, posted every Tuesday in the Facebook group. You can access essential resources and download practical Thrive Solutions packs, all of which are geared to help you thrive as a caregiver. We know funds are tight, so we offer all of our individual Thrive Solutions packs. Or for even a better deal, you can get lifetime access to all of our resources. Again, we're here to support you and help you thrive and to enjoy your life as a caregiver. And remember, this is a place to get hope, not just cope.
Dave Nassani, the Caregiver's Caregiver, has just released his 6th book,
entitled It's My Life Too. Reclaim your caregiver sanity by learning when to say yes and when to say no. It was specifically written for caregivers who know they should be putting their needs first, but just don't know how. Dave is the sole caregiver to his wife, Charlene, since 1996. He knows firsthand what caregivers are going through, because he is one. And he now speaks all across the country, offering caregivers his incredible caregiver support package. Even the airlines tell us that in the event of an emergency, to put your oxygen mask on first, before you help your child with their mask. They know that those who don't heed their advice often black out, thus becoming unable to help either themselves or their child. And caregivers are exactly the same way. It's My Life Too. Reclaim your caregiver sanity by learning when to say yes and when to say no. Will help caregivers who are neglecting their sleep, diet, and social life, and learn to put their needs first. Pick up your copy today, or buy one for your special caregiver. On sale everywhere, and at caregiverscaregiver.com.
And we're back with Dave Nassani and Helen Justice on the Caregiver Dave Show. And wow, I am just so excited that I have you on the show today, because you are going to answer a lot of people's questions. Now, I always say, I use the term the caregiver tsunami, that, I compare caregiving and care facilities to Medicare and Social Security, because so many people are pulling out of the system, and not enough people are putting into the system. And that's how it is with caregiving right now. 30% of caregivers are dying, 60% are getting hospitalized, getting sicker than the ones they're caring for, eventually needing a caregiver of their own. And yet there are a shortage of caregivers.
Correct.
And there's a shortage of facilities. They're not building them fast enough. But the biggest problem is that who are the people who are getting older and needing the care? It's the baby boomers. The largest segment of population are now entering into their 60s, 70s, 80s, and these are the ones who are getting Alzheimer's and dementia and ALS and Lou Gehrig's disease, falling down, breaking a hip, needing a nursing home. And so I'm just fearful for what's coming on the horizon. I'm here in Hawaii, and if a tsunami was coming, I could see it from my hotel room. And it's just, oh my gosh, what am I going to do? And there is a tsunami, and it is coming.
It is.
How do we keep from freaking out? How can we survive this tsunami, especially if we're a baby boomer or the child of a baby boomer, the adult child?
Yes.
Give us hope, Helen.
I'm sure that you've heard that 10,000 baby boomers turn 65 every day for the next 17 years.
Wow.
10,000 boomers.
A day?
A day. So I want to think of all those nurses back then when they were delivering babies at $10,000 a day. But, it's a lot of people on the end of my family training. I have a slide with a bunch of people with their heads in the sand, and that's what the boomers are doing. They're thinking that the government will be there at the other end, and it's sad, but it is not true. And you're going to either be a burden to your family, you're going to run out of money before you die, and you got to wise up here and decide, what are you going to be doing? You're right. There's not enough places that's being built affordably. We've got places here in Northern California. We have 9 assisted livings in construction right now. 9.
9.
Yeah. And
there should be 900 being constructed.
Yeah, but you walking in and the basic is $4,000 or $5,000. Can you? And that's not even level of care yet. Not even level of care. So can you afford that? And so they're trying to get adult children to be caregivers. They get burnout. So we got to go back to the neighbors. Back to the communities. And I don't think that there's not enough. I mean, when Grandma and Grandpa was in their homes, the churches came in.
Or the kids, they lived with the family.
Yeah, family came in. But we don't have that now. We go home, We open up the garage, we pull our car in, close the garage, and that's the last we see of our neighbors. And so get to know your neighbors. So there's resources, but you just can't put your head in the sand because you're going to be caught off guard.
What do you propose that people do? I mean, there's long-term care insurance. When I was 49, I was told, you're the perfect age to get a long-term care policy. It cost me $110 a month, and I was 49. Now I'm 64, so that's 15 years. I've been paying $110 a month, which is kind of cheap, for a guy like me. And for the first time, it went up last year.
Yeah.
I was shocked. Went up 15%, which isn't much. I was paying $350 for medical insurance, and then Mr. Obama gave us Obamacare, and the next year it went up to $650, and then the next year it went up to $950, and the next year it went up to $1150, and then this year they wanted $1350, and that's when I called it quits.
Yeah.
I says, I joined this medical savings plan group, which has now cost me $650, not knowing if they would pay if something happened. But I did cut my finger with a skill saw down to the bone, and a $35,000 hospital bill.
Wow.
To my amazement, they paid all but $3,000 of it. So,
wow.
But I just have to get to my 65-year-old Medicare, which is like 5 more months. I hope I can make it, Helen. I hope it's still there waiting for me when I get there.
It will be. But, long-term care, if you're talking to people that are utilizing their long-term care, what's happening with the insurance companies, they're making it harder for you to use it. And,
oh, really? What are they doing?
Well, okay, you've got a person that's demented, and they go in, and a nurse from the insurance company comes in and does their assessment. Well, they do it without the family being there or somebody, the caregiver. And so they say, well, can you take a shower? Oh, yeah, I can take a shower. Can you put on your clothes? Yes, I can put on my clothes. Right there, they're done. And they
scam doctors. Doctors. Okay.
And
so can we be there with them during this? Yes. Do we have the right to say?
Family needs to be there. Yes.
Okay.
And then the activities of daily living. You're bathing, you're dressing, medication, hygiene, and transferring. Well, years ago, there used to be another ADL called ambulation. The walkers, the canes, the wheelchairs. Well, they took that off the table.
Really?
And that's no longer an activity of daily living. So slowly but surely, they're dropping all those activities. So I don't recommend long-term care.
Oh my gosh, really?
Yep. I recommend a whole life insurance policy with a long-term care rider.
How does that work?
Because, Dave, if you don't use that long-term care, you die before you get to use that long-term care. Who gets the money?
They got it.
That's
already
right.
got
So
it.
they ring the bell. Woohoo! They got another one.
They won.
So whole life insurance policy with a long-term care rider. If you don't use that long-term care, who's the money go to?
Beneficiary.
That's it. So that's why I recommend a whole life policy with a long-term care rider.
Is the cost similar? Like if I got a whole life term, just a whole life policy with a long-term care rider.
Yes.
And we're not talking about term life insurance because that's just strictly insurance. Yeah. So would it probably cost me $110 at a 49-year-old male?
Well, it's going to depend on your health.
Yeah.
And so,
well, I was healthy back then. Yeah. I'm still healthy, but I was on zero medication for so long. But now, I take a little water pill to keep my blood pressure, in normal range. I'm just borderline, and I take a pill to help me pee because something's happening to my prostate. It's getting bigger, and it's just the normal age. But once you start taking medication, you start going into a different tier of assessment.
So when you're in your 50s, 40s and 50s, look at a long-term care, whole life policy. Get with your financial planner. You're doing it for retirement. So ask them about the whole life that they had the writer. So not everybody hears it, but it's better than what is happening.
It's a great idea, Helen, and you're the only one I've heard recommend that. Usually everyone is espousing the wonders and the benefits of long-term care. But since I'm already committed to it, and it's probably too late for me, can they change the terms of my policy that's 15 years old? I mean, am I grandfathered in for something?
Well, and when they take away the activities of daily living, that's what they take away. And so if you don't meet the criteria, you can't use it.
So even though I bought it 15 years ago, they still have some power.
Years ago. Yep, they can make the changes.
So does that mean if I'm using a cane or if I'm using a walker, I used to be eligible for my long-term policy to pay, but now I'm not?
Exactly.
Now I have to Now I have to be bedridden, for example.
Well, or you got to look at, first of all, pull out that policy and look at your schedule of events. And what does it cover? Go over it, because a lot of people like your trust that's up on the shelf and they haven't looked at it in years. So do you have an elimination period? What does it cover in-home? Does it cover a skill? Does it cover, assisted living or in-home care? Look at your policy and see what exactly it will cover. So I
think mine has a 60-day elimination. That's normal, isn't it?
Yeah, some are 30, 60, 90
and
days.
It has a maximum amount of money that they will pay out.
Right. And some of them, there's some policy, it's life. For instance, state workers here in California, there are policies out there that I'm seeing that was a lifetime long-term care policy. So those were good, but that's right now in California, they're in trouble with that program.
Really?
So you just got to stay up on it, just like your legal documents. What's it covering? What's it not covering? And if you got a parent that is going to be using long-term care, be there when the nurse comes and does the assessment. Don't let them do it by themselves.
Well, how do they get away with that? Do they just pick up the phone and say, yes, I'm...
Yeah.
So they'll call up the parent, for example.
Yeah.
And they won't say, oh, well, make sure you have your caregiver with you, or make sure, whatever. They'll just say, I'm coming at 3 o'clock. Will you be home?
Yep.
And the next thing you know, bim, bam, boom, it's done, and you weren't even notified. And, of course, your parent might be a little soft in the head, and they're not going to pick up the phone and call you. So
exactly.
Helen, we're so glad that you are out there doing this. I feel so much safer now that I have someone to call when I become, I'm not going to confess that.
Yeah.
I hope that, like the Bible says, my youth will be restored like the eagle. I will walk and not grow weary. I will run and not be faint. But you never know. Tomorrow's not promised.
And what wacky weed are you smoking?
So, my goodness, the hour surely has gone fast. If somebody has some questions, no matter where they are in the country, how do they get a hold of you? How do they find out more? Can you send them something? Give us your contact information.
So, first of all, they can Google me, Helen Justice, GCM, in Roseville, California. I do have a website, advancedwellnessgcm.com. There's a lot of information. There's blogs out there. So you can sign up for my newsletter to get the latest and what's going on and the changes and everything. And
I'm going to sign up for that.
Yeah, sign up for it. Or if they're in the local area, they can come to one of my family trainings. So they'll click on events and sign up for one of my trainings. There's a veterans tab. It will give you content there to how do you qualify for that. So those are some of the ways. Also, my email address, helenjusticegcm@gmail.com. So several ways that you can get a hold of me.
What's the GCM stand for?
Geriatric Care Manager.
Duh. Well, Helen, thank you so much for coming on the show. I really, really appreciate it. And go ahead and keep telling the world, keep scheduling yourself, keep talking at these Lions Club groups and everything, because the word needs to get out. People need to understand that the government's not going to be there. Medicare, who knows what's going to happen with that, but we need to get our heads out of the sand, don't we?
Yes, We sure do. Thank you for having me on the show.
Thank you for coming on, and I just want to say that I'm Dave the Caregiver, and caregiverdave.com is where you'll find my membership website, and I would encourage everyone to go on there and check it out because, you know, there's no guarantees. No guarantees.
No, not at all.
You can become a caregiver tomorrow. You know, my wife at the age of 52 just, boom, she suffered a stroke. She was in great health. Nobody knows why it happened. And I didn't even know what a caregiver was, but all of a sudden I was one.
Absolutely.
So check it out. We're just trying to help you people. We're not trying to make you feel bad, not trying to make you feel guilty, not trying to take your money. We just want to make sure that you are in a place of help. So bye-bye.
Thank you for listening to the Caregivers Caregiver radio program with Dave Nassani.